Youth Wellness Hubs Ontario is an initiative that is aiming to transform our system of care with addictions and mental health services in Ontario for youth through providing a walk-in integrated model of service. Our services are provided for age 12 to 25. There are currently 10 hubs that have opened doors or are in the process of opening their doors across the province. The Provincial System Support Program, PSSP, at CAMH works with community service providers and other partners across Ontario to move evidence to action to create sustainable system-level change. PSSP is providing backbone support in the implementation of hubs across Ontario alongside the Centre of Excellence for Child and Youth Mental Health. So a little bit about YWHO Equity and Engagement, Youth Wellness Hubs Ontario Equity and Engagement, and this learning series. Equity and youth engagement are important aspects of Youth Wellness Hubs Ontario. This is reflected in the core components of the model and in this training, in the trainings that are going to be planned across the province. The backbone will be supporting sites with a variety of in-person trainings over the next year, and updates on this will be coming soon. This virtual learning series aims to further contribute to ongoing learning related to equity and engagement. Youth Wellness Hubs Ontario Equity and Engagement Learning Series will support sites in their ongoing efforts to meet the unique needs of all youth in their communities, especially youth who are often excluded and marginalized. Our hope is to bring you interesting and innovative perspectives from service providers, policymakers, researchers, and most importantly, youth themselves, highlighting specific ways in which services can be made more inclusive and responsive for diverse young people. For future sessions, we will welcome your feedback and ideas. We'll be reaching out to your sites and also working with the provincial and local youth advisories to identify topics of interest and need. There will also be a section in the evaluation today that will ask you about what other topics you see as important and valuable within providing service to young people. Please fill this out. It will be super beneficial to us and help us know what we can do in the future. Almost done. The story of how this came to be, the first topic, it happened very, very organically. There was a conference called Restoring the Circle, Trans Youth Inclusion in Healthcare, which is where I met Faye. It was at Ryerson in June, and it was completely youth-led, and it was very clear how important that was. When connecting with different sites, there was a trend in learning needs of how to best support the intersectional identities of trans and gender nonconforming young people. So from this, we recognize the importance of young people speaking and educating on best practices and their lived experiences of how to meaningfully provide affirming and equitable care. My name is Nikita Sunar. I use she, her pronouns. I'm an equity coach with the GTA site at PSSP. I support 4 sites, so Toronto East, Toronto Central, Scarborough, and Malton. I'm also a queer person myself, and I really strive to bring racial justice and equity into the work I do. So without further ado, I want to pass it on to Faye and Jack to introduce themselves and talk about trans-affirming care.
Cool. Perfect. Awesome. First off, thank you folks for having us here today. I think we're really excited for the next hour or so that we have together. And so, yeah, let's get it started. As Nikita mentioned, we're here to talk about everything gender inclusion in action and how to provide trans-affirming care to the young folks who are accessing your services. I'll start off by introducing myself, and then I'll pass it over to Jack. So as I said, my name is Faye Johnstone. I use she and they pronouns. Either one is good. You can change it up, keep it interesting, whatever works for you. I work as a trans and LGBTQ educator in Ottawa on unceded Algonquin territory. I spend a lot of my time building the capacity of health and social services to do justice to trans young folks and all gender diverse or LGBTQ youth. I have a background in child and youth mental health, so I worked for a couple years at the Ontario Centre of Excellence for Child and Youth Mental Health, and currently I'm one of the members of the Centre's Strategic Advisory Council, and I currently work with an organization in Halifax called Wisdom to Action that does community engagement and knowledge mobilization for health and social services across Canada, while also slowly but surely pursuing my master's in social work at Carleton University.
Cool, thanks. So my name is Jack Lewis. I'm based here in Toronto, so I'm a trans biracial individual. My pronouns are he, him. I do advocacy and education in like LGBTQ plus communities of color predominantly. So currently I am working in a residential care setting. I also do different kinds of consultations for equity. And right now I'm trying to get my CYC diploma. I'll also do, I'm sorry, I'll also do land acknowledgement. So here in Toronto, this is the territory of the Wendat-Petun First Nations, the Seneca, and most recently the Mississaugas of the Credit River. So today the meeting place of Toronto remains home to many Indigenous peoples across Turtle Island, and I would love to pass it off to Faye now.
Yeah, and so I'm joining folks, as I said, from Ottawa, and so this is unceded, unsurrendered Algonquin territory. We talk a lot about land acknowledgements, but throughout this webinar, I would challenge us to think critically about the land that we're on and the histories on this land, the histories of violence and oppression that has taken place on this land, and to try to engage critically with the interconnected nature of queer and trans identities and experiences and Indigenous communities. I challenge us to think about how gender and sexuality have often been used to marginalize and oppress the people whose land this is, and to engage critically to ensure that we're not putting, Indigenous young folks over here and trans young folks over here, but realizing that these are interconnected issues and that inclusion for some of us has to be about inclusion for all of us. Now, in terms of, before we get too far into it, we actually do want to start with a little poll, which I think is very fun. And so I think in a moment there should be a poll popping up on your screen as I speak, just so we can get a sense of who is joining us today, what role you play in your organization, and which site you might be joining us from. So I'll give you about 12 whole seconds to fill that out, and then we will move on.
Cool.
Fun because we get to watch like the live numbers come in, and so the service providers are winning and the backbone staff are not.
Okay.
We're going to give you another 7 seconds before we get into the meat of it. So if you haven't voted yet, again, service providers are winning. There is still opportunity for a comeback from the backbone staff. Okay, so I'm not seeing the numbers shifting all that much at this point, so maybe we can bring it back.
I think we have to put our video on again.
Yeah.
Perfect. And so I think that you folks are probably now seeing our next screen, and we'll give Jack and Nikita, who are now back with us, perfect. So in terms of our objectives for today, I'll just go over it just so we can keep ourselves grounded in those objectives, make sure that we're keeping them consistent in our heads and framing everything around them. So our objectives today are to identify terminology and concepts related to gender identity, to trans experience. We're also going to work through some of the key elements of trans-affirming and trans-inclusive care through a lens, again, that doesn't think of these issues as siloed, but as interconnected, so intersectional. We will also walk through some of the challenges and barriers that face trans young folks when they're accessing health and social services, and then identify some particular practices that can help create inclusive settings and inclusive practices and care in the YWHO context. And at the end of the day, we are going to make sure or talk about how we can really appreciate the rich knowledge, experience, and I would say brilliance of trans and gender diverse young folks in understanding our own experiences, in prioritizing our needs, and really making sure that we're doing justice to the voices of trans and gender diverse young folks in our communities and in our services.
Ooh, awesome. Okay, my bad. Okay, so I'm just going to take us through the agenda for the webinar. So first we'll start off with Gender 101. So this means setting the stage for gender inclusivity and going through some terms and definitions. Following that, we'll go into gender affirming and trans-inclusive care and the work that we're doing and why that matters. Thirdly, we'll move into some context pieces. So looking at some experiences of trans youth in Ontario. Then we'll look at putting that theory into practice. So for example, what it's like for folks accessing different resources and different services that are being provided in the hubs. And then lastly, we'll go into the Youth Wellness Hubs Ontario context and how we can take these practices and ideas and put them into action. And we'll go through different services such as primary care, clinical service, mental health support, housing, and employment. At the end of the webinar, we'll have 15 minutes for a Q&A, and you can hold your questions either for the end or you can put them in the chat box throughout. And so we'll also be providing you with a 2-pager on best practices to support LGBTQ plus youth. The slides will also be available, as I already confirmed. And throughout the webinar, this webinar is going to be recorded. So if some of you folks aren't able to watch it live, you can access it afterwards. And also, we would really appreciate you filling out our little questionnaire that we have at the end, just so we know what more information you folks are looking for, and if we can shape any other webinars to those needs. We also want to emphasize that this workshop won't answer all the questions that you probably have, but this is more so about the building blocks of inclusion. It's not a prescriptive approach, so the experience that I'm sharing, and I'm sure the experiences of Faye as well, aren't that of the whole communities. They're just personally ours. So yeah, everyone experiences everything in their own way. Let's just get started. So,
Perfect. We're doing a whole thing back and forth.
Yep.
So I believe we actually are starting with a poll. And so my question for folks is, what does gender mean to you? I say this and I want to emphasize that there is no remotely wrong answer to this question. We all experience our gender in different ways. We have different ways of thinking about it. But at this point, we would really encourage folks to, let us know a bit about what you think gender is and what it means to you. And you have 30 seconds for this poll.
Yeah. Mm-hmm.
Mm-hmm. I also love this because I think, again, we're seeing the answers maybe before other folks are, and so I'm feeling powerful as I get a glimpse at all of this first.
Yeah, no, I love this. Social control, a layer of identity.
How I express myself.
Yeah, so I think I'm going to start, I'll start debriefing and talking through a bit of this as we go. So gender is, at the end of the day, it's a lot of different things. And I think that's something that's coming through quite clearly already from the responses that we're seeing. So we're seeing folks talking about how it's a layer of identity. It's an expression of who we are internally, and it's also about how we express that to other people. It's something that is a social presentation, and it's 100 other things. Our point with this, more than anything else, was to demonstrate that gender isn't just one thing. We all experience our gender in different ways, depending on the world that we live in, depending on our relationship to our bodies, our relationship to ourselves. And so gender is this massive, massive umbrella of experiences. Now, when we think about gender, I usually talk about it as something that is assigned at birth, right? So when you're born, the doctor is like, oh, you have these bits, so you must be this thing. And from there, you're assumed to be that thing. But we know that that isn't the reality of everybody. That doesn't work for everybody. And so gender is assigned at birth, but is also something that we identify as. So we have the autonomy to articulate what our gender is and how we experience it. And so instead of gender, we often think of it as, two little boxes, but it's actually a universe of experience. We can be so many different things. And it's really up to us to describe and define, because at the end of the day, it's something that is constructed by talking about it. And so I usually think of it as socially constructed. So yes, we create it by talking about it, but it's also very personal and very important. Everybody in the responses said something different about how they think about gender. And that demonstrates that there is no universal understanding of gender. But it also is important to think about how gender impacts us, how the world is shaped by how our gender is engaged with and perceived. And so gender is indeed socially constructed, but it also is deeply personal because it shapes our safety, it shapes our communities, it shapes the world that we live in.
Sweet.
And as part of that, oh, sorry. Yeah, over to you, Jack, sorry.
No worries. Okay, so they broke down the concept of gender for us. So now it kind of leads us to where do trans people fit in? And what is trans and what does that mean? So let's break that down a little bit. So trans is an umbrella term that refers to someone who does not identify with the gender they were assigned at birth. So that includes people who are non-binary, who identify as a trans man, trans woman, genderqueer, and two-spirit. Me and Faye will define these a little later on, so don't worry about that too much right now. But there's also additional genders, and more new terms for genders keep coming up, especially within different cultures, different places in the world, and even within Ontario, especially rural Ontario. So I'm just going to pass it to Faye, and they're going to go a little deeper in gender and identity and gender expression and what that's like.
Perfect. So when we think about gender identity or gender, it is this large, giant umbrella of experience, and so it's useful to talk through some of the more specific terms that we might use, just to help us break it down and be a bit more clear in our own perspectives around what gender actually looks like. And so when I think about gender, I think about two clear categories. I think gender identity and gender expression. Gender identity I would describe as your internal sense of self. Deep down within us, most of us have some idea of what our gender is, and that is relates to how we'd like people to refer to us. It might have some relationship with how we express ourselves, but it really is an internal sense of self. Now, that is one thing, and that is internal. Entirely separate from that is our gender expression. It's how we express our gender to people around us. In a world that is full of gender roles and gender norms, there's a lot of stereotypes around what gender looks like. You know, women are meant to wear long dresses, have really nice makeup, paint their nails, and do all of these things. And so there is like a degree to which gender expression is coded through our society, but it is also how we take agency over our presentation. It is the ways that we choose to express ourselves in gendered ways. Or that we choose not to, because we don't have to ascribe to the social roles or norms that our world teaches us that we should. Now, when I do education with health and social services, a big question is always, okay, so I get it, gender identity is your internal thing, gender expression is your external thing. Where does this whole biology thing fit in? And I usually respond to that by saying that it fits in exactly two situations. The first of which is when you're trying to access primary care, because that is a time when, yeah, the bits that you got going on, the body that you have is often quite relevant. And the other situation is when you are hanging out with a potential sexual partner. And that is pretty much the only instances where somebody's biology is relevant, where it's relevant to their mental health, where it's relevant to how they exist in the world. It's always about gender, because you don't know people's bodies, you know the gender expression, and maybe a little bit about their gender identity, and that's pretty much everything. And when it comes to sexuality, I think of gender identity and gender expression as like two wonderfully diverse universes that have all kinds of things going on, and sexuality is kind of a universe of its own. It might have a relationship to gender, so you know, we're attracted to people based off of their gender more often than not. But just like anybody else, trans folks and gender diverse folks have diverse sexual orientations. There are straight folks, there are bi folks, there are gay folks, everything and anything that you can imagine that other folks have, trans folks have too.
Mm-hmm. So, as I mentioned before, there are way too many gender identities to name or even define. But we're going to give you a little understanding and some context around some of the terms that you're probably going to encounter in your practice. Also, it's important to remember not to assume anyone's gender identity. Just listen to them in the language that they use to describe themselves, if anything. So starting with transgender. So transgender is someone who doesn't identify with the gender assigned at birth. So that term can include trans men, trans women. When you're working with someone who does identify as a trans man or trans woman, they might not want to be recognized as trans, and it's important that we need to respect that. So as I said before, it's important to listen to the language that the young people are using and mirror that back to them. And recognizing the difference between trans masculine and trans feminine folks and the way they experience the world around them, just like the way a black trans masculine person is going to experience the world differently from a white trans masculine person. Race plays a huge role in how we're seeing the world and how we're treated, and so does gender on top of that. So I'm going to move on to cisgender. Cisgender is a term that includes folks who identify with the gender that they're assigned at birth. So probably many people watching this webinar, if you don't know what cisgender means, you probably are cisgender. The fact that people don't have to think about their gender is an inherent privilege, and it's important to recognize those privileges, especially when you're providing care to like queer, trans, and gender nonconforming young people. So I'm going to move into non-binary. So non-binary is an umbrella term as well that basically encompasses folks that may identify outside of the spectrum. So non-binary folks can identify also within the spectrum. For example, you might encounter folks who identify as a non-binary man or a non-binary woman. I think it's also important to note that experiences of non-binary folks are so varied and specific to each individual. There might not be folks who agree with the definition I just provided because it's so personal to their experiences. All this to say that definitions are like boxy and weird, and let's try to stray away from them and just listen to the people that you're caring for as much as you can. So I'm going to pass it to Faye.
Yeah, so the next two terms I'm going to walk us through are two-spirit and intersex, but I just want to build off what Jack was saying real quick around like trans and cis. The important thing to note here is that trans isn't actually a gender identity. It is a descriptor of gender. So again, like a trans woman's gender is being a woman. A trans man's gender is being a man. a non-binary trans person is a non-binary person. And so a lot of the time we mix that up, and so it's just important to keep that in mind because we often get too focused on the fact that folks are trans, and it's not always relevant, and you don't always need to emphasize somebody's transness when you're providing care or when they are out and about and living their lives, because we also live our lives too. Now, Two-Spirit is a word that I'll preface by saying that I am not Two-Spirit and I am not Indigenous. I am white and a settler on this land, but Two-Spirit is a term that actually has some very interesting and particular roots. When white settlers came onto this land, they brought a gender system with them, a gender system where you either had to be a man or a woman. And if you were a man or a woman, you also had to be straight. When they came to Turtle Island, so North America, they encountered nations and communities and cultures across this land that had different understandings of gender and sexuality. As part of the colonial process, settlers did what they could to eradicate references to gender and sexual diversity on Turtle Island by erasing as best they could language, by stigmatizing and shaming people, and doing this whole process as part of the colonial process to make sure that people fit as rigidly as possible in the rigid gender system that the West is, to this day, so very obsessed with. And so as part of that, a lot of language was lost and erased. And so Two-Spirit is actually created at a conference of Indigenous LGBTQ2+ folks in the 90s in Winnipeg as an umbrella term that could capture a lot of that gender and sexual diversity that was intentionally erased through colonization. A lot of the language was lost. A lot of the terms that different cultures or communities used was intentionally removed. And so Two-Spirit is meant to be an umbrella term for a lot of those experiences. The important thing to note here is that Two-Spirit is not a term that all LGBTQ2+ people who are Indigenous use, but it is a term that many do. As well, it is important to engage with the fact that as folks who aren't Indigenous, if you are not Indigenous, this language is not yours, regardless of if you are LGBTQ2+ or not, because Two-Spirit is a term that is both gender and sexuality specific, but also specific to Indigenous communities and culture. The last term here after is intersex, and so intersex is a term to describe people who do not wholly and completely fit into the physical anatomy boxes of being male or female. That includes a massive diversity of people, including folks whose bodies might not be easily categorized into either of those boxes, but also including folks who have other diagnoses like PCOS, or who might have more facial hair than is assumed to be appropriate for the physical sex that they were assigned at birth. And so when we talk about LGBTQ diversity, we often leave intersex folks out of those conversations, and it's important to bring them back into it because they also have experiences that are particular that we need to make sure that we're providing inclusive care around. Mm-hmm. I'll note before we move on that as Jack also referred to, all of these definitions are great and they're useful tools, but they are by no means universal, and different folks might describe their experiences in different ways. And we need to give folks space to do that. Throughout history, we have taken language away from LGBTQ people, and we've tried to use that language to force them back into these boxes. And it's important that we don't continue that legacy by setting ourselves up as authorities over how trans and gender diverse folks describe themselves or their genders.
Mm-hmm. So we talked about how being trans is a spectrum already. And so when we talk about transitioning, it's important to recognize that there's no objective way to transition. So what does transitioning even mean? So essentially it's someone's personal experience. And since there's no objective way of transitioning, it's important to recognize that it is personal to each individual trans person. So you're probably going to encounter folks who are interested in maybe taking hormones or getting surgeries. You might even encounter folks who are not interested in either of those things. You may even encounter folks who are interested in maybe one of those things, like just surgery or maybe just hormones. Also say transitioning looks different for everyone, and not everyone wants to pursue medical interventions throughout their transitions. So often service providers such as counselors, nurse practitioners, or doctors, because of their lack of understanding and because of those assumptions, there's always intrusive questions that come up, forcing young people to prove that they're trans enough. But the fact of the matter is there's no cookie cutter transition, and everyone's transition goals and needs are different. So Faye is just going to go over some common misconceptions that we as trans folks have to face.
Perfect. So in terms of some of those misconceptions, just like Jack just mentioned, there's this conception that all trans people have surgeries and go on hormones. This is actually rooted in an idea that trans people have to prove their gender identity to people, and is also demonstrably false. Not all trans folks want access to surgeries, and not all trans folks want to go on hormones. Accessing hormones or surgeries doesn't make somebody any more or less trans. And I would actually challenge folks who aren't trans to think, have you ever gone in and got your hormone levels tested? And does that qualify you or not qualify you for being the gender that you know yourself to be? No, that's ridiculous. And so we are the gender that we are because it is the gender that we say we are. That being said, trans folks deserve access to all kinds of transition-related healthcare that they desire because we have healthcare needs too. There's this other stereotype that all trans men are very masculine, all trans women are hyper feminine, and genderqueer and non-binary people just fall right in the middle and are completely androgynous. We know that it's a kind of sexist notion to think that all men have to be super masculine and all women have to be super feminine, and we shouldn't take out our anxiety around gender roles on trans people. Trans folks experience and express our genders in massive and phenomenally diverse ways, just like everybody does. Trans folks are a trans man is no less of a man if he loves makeup and lipstick, and a trans woman is no less of a woman if she really just wants to wear sweatpants for a day or two. The last thing is this idea that trans folks share a particular value system, share a political ideology, or a certain set of ideas about gender. As we've chatted about a few times, trans folks experience their genders in so many different ways. And we also don't actually have a united political value system. We don't just gather together in our small little towns and say, okay, this is our political agenda. That's not how our communities work because we are, again, as diverse as everybody else is. Now we're going to shift gears here because we've rambled a little bit about gender theory and who are trans folks, and we're going to bring it a bit more particularly into gender inclusive and affirming care in practice.
So it's important to recognize that while the stats that you probably see, talk about trans youth are kind of depressing, it's also pretty dehumanizing because trans people aren't numbers, we're people, right? So the reason that the stats on trans folks experiencing higher rates of mental health, homelessness, and suicidality is not because they're trans, it's just because of the system that we live in. It's not safe for us. So as we've mentioned, systems aren't created to include people who don't fit into those binary boxes and all those other intersections. It's really for people who are higher in the class scale. So young trans people often have to see multiple healthcare providers to get access to care. And there's a lot of gatekeeping through that and a lot of referrals that have to be made. And it can hinder service and overwhelm and create a sense of rejection. So this is why gender inclusive and trans affirming care matters. And I really want to emphasize the experiences of trans, Black, Indigenous, and youth of color. And it's important to recognize the prevalence of police harassment and inadequate care services for young people who live with these identities. So trans young people experience higher rates of the above just due to the social, cultural, political, and economic factors that shape the world they live in. So when you have to prove your gender every day, when you're faced with countless racial microaggressions and acts of violence, your mental health is impacted. Race is complicated and impacts how you live your life, and the experience of a Black trans person is very different than the experience of a brown trans person or an Indigenous trans person. And we can't just lump everyone's experiences and identities together.
Perfect. So we've talked a little bit about gender affirming care, and we've talked around it a little bit. But if you don't know what it is, gender affirming care is essentially, I would say, the gold standard in inclusive evidence-based care for trans and gender diverse children, young folks, and their families. And it was actually founded by Diane Ehrensaft, who is a clinician, I believe, in the States, kind of as a new way of thinking through and ensuring that we're being inclusive of trans folks every step of the way. It is based on a ton of different principles, and I would encourage folks to Google gender affirming care and Diane Ehrensaft, because there's some really good resources out there that go into it in more depth. But the 4 principles that we wanted to highlight today are, first, that trans identities and gender diversity do not constitute a mental disorder. We are not fundamentally mentally ill or fundamentally more likely to struggle with suicidality, mental health, depression, anxiety, etc. Variations in gender identity and expression are actually normal aspects of human diversity, and binary gender definitions do not always and can never even begin to reflect the true diversity of our communities. Gender identity is also something that is always evolving, and it involves an intense and complicated interplay of biology, development, socialization, and culture. For some people, it might be more of biology. For some people, it might be more of development or socialization. It depends on the person, and we are not at the point where we're able to, pinpoint exactly what gender identity is rooted in, because I think it's actually rooted in something different for everybody. If a mental health issue exists, and yes, the statistics say that it often does, that issue is more often rooted in stigma and negative experiences as trans people in a world that fundamentally doesn't like us all that much, rather than being intrinsic to either the child or young person or the person's trans identity. We live in a world that doesn't like trans people, and that is what leads to increased mental health problems, nothing related to our actual trans identity.
So because you're going to be working with like a bunch of different people from varying backgrounds, it's important to really understand what intersectionality is. So I'm just going to give you kind of like the concrete definition of that. So intersectionality is a term by Dr. Kimberly Crenshaw in 1989. What an icon. So Dr. Crenshaw states that intersectionality is just a metaphor for understanding the ways that inequality and disadvantage compound themselves. So they create obstacles that are not often understood in the conventional ways of thinking about like anti-racism or feminism. So for example, intersectionality is just a prism for understanding certain types of problems. Like African American girls are 6 times more likely to be suspended than a white girl in school. And that's probably a race and a gender problem. It's not just a race problem, and it's not just a gender problem. So us as individuals, we all have like different identities that coincide with each other. So for example, I'm a biracial, queer, and trans person, and those identities all intersect and impact how I interact with the world and how the world interacts with me. Other forms of intersectionality that you're definitely going to come in contact with include gender, religion, sexuality, disability, class. And class plays a huge role in how we're treated and how we access services. You can't change the outcomes without really understanding like how they come about. So service providers, it's really your role to take a lead on being responsive to the youth and recognizing their own intersections and how to like care for them through that. So I'm gonna pass it over to Faye, and Faye's gonna be going over like what it's like accessing services.
Yeah. So in Ontario, I'm just going to paint a bit of a picture of what the context of trans and gender diverse young folks is. Again, we decided not to just put a giant screen of some of the depressing statistics up on the screen, but some quick ones are 50% of trans folks in Ontario make under $15,000 a year. 47% of trans young folks ages 16 to 24 have seriously considered suicide in the past year, and I believe 19%, don't quote me on that, have attempted in the past year. And so you get the picture on that. That is Ontario data that demonstrates that we have significant issues in terms of doing justice and helping improve the health and well-being of trans and gender diverse kids. Now, when it comes to health and social services, trans children and young folks unfortunately do not feel safe accessing our services. 1/3 of young trans folks and half of older trans young folks have missed needed health care, and more than half, or even more, have missed needed mental health care. This is because trans young folks have had unpleasant experiences accessing our services. More than that, it is also because of the fact that we live in a society where services have historically stigmatized trans and gender diverse communities. And so this, to me, demonstrates the need to set a gold standard and a higher bar on trans and gender diverse inclusion in health and social services. 52% of trans folks in Ontario have access in the emergency room and had a negative experience doing so, whereas 21% have avoided the emergency rooms when they needed it because of fear of mistreatment. Now imagine being a young trans person who breaks a leg, sprains something, or in some way needs access to emergency medical services, and you have to sit and think, okay, do I feel safe accessing an emergency room? Am I at a point where I can deal with a doctor misgendering me? Where I can deal with somebody reading aloud the name on my ID that might not be the right name, and that might trigger a significant degree of discomfort for me? And so reflect on those things when we think about, these are things that trans folks have to reflect on when they're trying to access services, when at the end of the day, they should be trying to think about how to get that broken bone fixed. And so being trans adds in a whole new dimension to our experience accessing health and social services that as service providers we need to be cognizant of. and we need to be actively working to shift these services to make sure that trans folks feel safe accessing them.
Yeah. So I was able to go into my community talk with a couple of trans folks about their experiences accessing different kinds of services, and we created this little mind map here, and we broke it into sections of what went really well during their care, and also what didn't go so well. So a lot of the key themes when talking about what went wrong during care were essentially assuming that all of our experiences were the same, not allowing space for trans people to self-identify and use their own language, not offering services to trans people, period, not knowing the appropriate referral resources, and service providers making mistakes and then making the mistakes about them and then having the young person comfort them through their mistake, asking the youth to educate instead of doing your own research, forcing the youth to come out under care, and lastly, assuming that everyone can follow the same treatment plans and not working through an intersectional lens. On the other side, though, when it came to discussing what went right, though, it was mostly centered around respect and what that looked like. So respecting our pronouns and name, allowing us to use our own language when describing our mental health, our bodies, and not being corrected. Being seen and represented in the staff, being offered support from providers who have similar identities. This also shows awareness within the spaces. Being knowledgeable about resources, and lastly, service providers recognizing their own limitations and being transparent about them, and having the willingness to learn on their own time, rather than leaning on the person they're supporting for education. So we're going to move into inclusive care from theory to practice. So at the end of the day, trans-affirming care is meeting people where they're at, avoiding imposing your own ideas onto others, acknowledging the clients as the expert in their own identities and experience, and shaping the care around the needs of our clients through an individualized approach to care. So I'm just going to pass it back over to Faye, and Faye's going to talk about pronouns and confidentiality.
Perfect. So pronouns, I'm going to start by saying what they are. We both introduced ourselves as ours, but I know there's still a degree of confusion around pronouns. So pronouns are essentially stand-ins for names. If you don't know somebody's name, you use a pronoun or a pronoun instead. They're also for when we don't want to just have to say somebody's name, because that can be tedious time and again when you're referring to somebody. Examples of pronouns that are quite common are he and him, she and her, and they and them. But there's also other pronouns out there. There's pronouns that are being invented that best reflect folks' gender identities. And just like you might pause to get to know somebody's name and learn how to pronounce it correctly, if you meet a new pronoun, or if you meet somebody with a different set of pronouns than you used to, spend a bit of time practicing and you're going to be good to go. Pronouns really make a difference because they're a basic way of demonstrating respect to people who are trans and people who aren't. They're a way of demonstrating that you see people for who they say they are and that you respect them for the gender that they identify as. When it comes to putting pronouns into practice, I have a few recommendations for how we can help do that. First is provide opportunities for disclosure. What I mean by that is provide little invitations that allow folks to know that you're a safe person to disclose pronouns to. So for example, when I introduce myself, when I'm doing workshops or when I'm in meetings, I always introduce myself with my pronouns. I say, hey, my name is Faye Johnstone, and I use she and they pronouns. We then try to normalize it by inviting other people to share their pronouns too. The important thing there is that you don't force people to make that disclosure. It can be really uncomfortable for a trans person to have people being like, hey, tell us your pronouns, because you don't know if you're safe to do it in that space. And so try to do it in a one-on-one context and give folks an out if it's in a group context. So again, if I'm running a meeting, for example, I would say, hey folks, my name is Faye Johnstone. I am a community organizer and my pronouns are she and they. We're going to go around the table now, and if you'd like to, you can say your name, you can share your pronouns if you're up for it, and maybe what city you're from. And that provides an opportunity but not a requirement. The last thing that I'd share here is folks have a hard time with pronouns, I think because it's a new concept to a lot of people. If you practice it, it will become normal more often than you'd expect. A great way to do so that is also modeling best practices is to adopt gender-neutral pronouns and language when you don't know what somebody's pronouns might be. A lot of folks in healthcare are used to saying partner instead of husband or wife, and we should normalize and build on that. If you don't know somebody's pronouns and you haven't had a chance to ask, use they. It's a good singular option that is less harmful than using the wrong pronoun or making an assumption about somebody's identity that you know might not be accurate. Just like we know that gender identity and gender expression are not fundamentally connected, you can't tell somebody's pronouns or gender just by looking at them. And so asking is always your best bet. Like if you don't have the opportunity to ask, again, gender-neutral pronouns are a good way to go. Putting into practice confidentiality and privacy is equally important. Someone's trans identity is entirely confidential unless you've explicitly received consent to tell it to somebody else. A lot of trans folks are out and proud in this world. A lot of trans folks aren't and don't have to be or don't want to be. Tons of trans folks aren't folks that you would run into in public and presume to be trans people. And telling people that somebody is trans without their explicit and prior consent can open them up to all kinds of reprisals and violence. And so I think putting that into practice in all the work that we do is incredibly important.
I just want to even just add on to that. Presumably when you're introducing yourself to someone, they definitely are going to let you know their name. So you can even use their name when referring to them. But yeah, so mirroring how we describe ourselves. So mirroring how we describe ourselves means not like correcting the language that we're using, especially when talking about how we describe our bodies. So trans people describe our identities and experiences in all kinds of ways, and it's not linear. And yeah, sure, there are best practices around inclusive language, but at the end of the day, the person you're providing care for has their own individualized sense of self. It's important just to respect, affirm, and then mirror that. It creates a sense of inclusion, and it's very inviting. So I'm going to pass it off to Faye again. Here we go.
Perfect. So this is my favorite slide. I will never do a workshop on LGBTQ inclusion that doesn't include this slide. And so I'm going to go through it twice, first quickly, and then I'm going to walk us through it one step at a time. But I'm going to start by saying that from my experience in health and social services, I think we're afraid to acknowledge when we make mistakes. We come into this work because we care about people. We want to help folks who are having a hard time, and we want to be there for them when they need us most. That means that we really have a hard time realizing that we will make mistakes, that mistakes happen, and that they shouldn't prevent us from doing the best that we can. And so yes, you will make mistakes because we are imperfect human beings. No, that doesn't make you a bad person, but yes, it still hurts us, and we might respond with that in mind. No, that's not actually an inappropriate response, but yes, we want you to move on. Because no, it's not actually about you in that moment. However, yes, you can learn and improve. So again, yes, you will make mistakes. We all make mistakes every day of our lives. We are imperfect human beings, and there's nothing we can do to prevent that. No, those mistakes don't make you a fundamentally bad person. We know that mistakes happen, and we know that most people are coming from an approach where they're trying to do the best that they can. But yes, those mistakes do cause harm. If you misgender a trans person, so if you use the wrong pronoun to describe us, or you use the wrong name or the wrong gendered term, that does cause harm. And we might respond with that in mind. When that happens, you don't know if that's the first time we've been misgendered that day. You don't know if it's the second, the third, or the 50th. For a lot of trans folks, we experience violence in our everyday lives on a daily basis. When I leave the house, I have folks looking at me weird, I have folks staring at me, I all too often have slurs thrown in my face. You don't know when somebody walks into your services if that has happened to them that day. And so if somebody is emotionally responding to you, if they're feeling hurt, if they're feeling agitated or annoyed, I would beg for a moment of empathy that acknowledges the fact that your act of harm, no matter how small, is connected to a system of violence that shapes the everyday realities of trans people, and that while you might not be the one who deserves to be blown up at or have this whole issue become a bigger deal than it might seem like it should be, you don't know the lives of trans people, and in that moment, I think the best thing you can do is be there for them and comfort them if they're having a hard time. And so no, our response isn't appropriate. But we do actually want you to move on, because there's nothing more awkward than when somebody misgenders us or uses the wrong pronoun and spends 20 minutes making us feel guilty about the fact that they made a mistake. It is very legitimate to feel guilty in those moments, but our guilt, it's not our job to process your guilt for you. You caused us harm. We should not be the ones who are having to counsel you through it. And so no, it's actually not about you. But at the end of the day, and the thing that I want folks to walk away from from this conversation with more than anything, yes, you can learn and improve. You can do better. It becomes easier the longer you try. And yes, you will make mistakes as you do it, but we need you to stick around. We need you to keep doing that work. I joke when I do this slide that I am a trans person who has misgendered my partner. My partner is also trans. It does not get more awkward than being a trans person who has misgendered your trans partner. We got over it. I apologized in the same moment. I used the right pronoun, and we moved on. If I can make that mistake as a trans person, y'all can do it too. Just apologize, correct yourself, commit to doing better, and get on with your life, because I guarantee that we want you to get on with our life and our access to health and social services as much as you do.
Here, here. Right on. So we're going to talk about the building blocks of trans and competent care. So if we can acknowledge that trans communities are incredibly diverse, we also have to acknowledge that there's really no workshop or language guide that can perfectly equip providers to provide support to such a diverse population. The webinar is about giving you framework and some practical insights to supporting trans communities and clients. Like, we don't have all the answers. No one has all the answers. That's the reality of the situation. We're going to move into the Youth Wellness Hubs Ontario context now. So I'm going to go over like what an intake looks like. So let's start with intake. So first impressions make the difference. And when a young person walks through the door, there's an opportunity to kind of build that trust from the very moment of contact. Impressions last a lifetime, right? So some ways you can do that is like, you know, a warm hello or stating your pronouns and letting the young person know that they can do the same, like providing that space essentially. And also educating the young people who don't know anything about pronouns, because it's going to happen. People come from different cultural backgrounds where these things aren't as common, I should say. So when you introduce yourself, yeah, like I said, give them that space. Also let them know where the washrooms are. So whether they're single stall washrooms or whether they have like a urinal and a toilet, it's important to just give them all the information that they need. And it's important to do that with every youth that walks through the door, not just someone you perceive to be trans or gender nonconforming. It's also important to know the distinction between like the legal name and chosen name. When having to look at their health card, ask them what their name is. These things really do make an impact, especially when you walk into the space and you want to know it's for you. You want to be able to see the diverse staff, different signs, and like, you know, inclusive signs is what I really mean when I say different signs. Yeah. So I'm going to give...
I just want to build off what Jack said there around, you know, don't only ask people who you read as trans what their pronouns are. I do a ton of health and social service education, and the funniest thing is that no one has ever been surprised when I walk into a workplace, they know that I am their facilitator. Because they see me and they're like, oh, it's a trans person, and that's fine, I get it. But there's also tons of trans folks who, you know, don't get read as trans. Trans folks are everywhere. You have shared a washroom, an office. You have talked to trans people more often than you could even begin to realize. And it's actually a bit of a slight when you only ask people that you read as trans what their pronouns are, because A, you're saying, hey, look, it's a trans person. And that's just awkward and like unpleasant for all of us. And you're also ignoring the fact that people's genders at the end of the day cannot be assumed just by looking at them. And anybody could be trans, and somebody that you read as one gender might be a cis person of a different gender, and you might make that mistake. And so it's important to universalize that process. Sorry, Jack, I had to jump in. I had opinions.
No worries. I mean, go ahead, social demographic data.
Perfect. So I know one of the main things, or one of the things that YWHO is doing the best it can to be intentional about is socio-demographic data. This data is very important because it helps identify client need, identify populations that might be overrepresented, and help make sure that we're being intentional about necessary programs for particular communities or populations that are historically and contemporarily underserved. We pulled out some of the questions from those demographic questions that we thought were particularly relevant. And I'm just going to walk through a couple of them just to think of how we might actually ask these questions if we're having a conversation with a client. So what name do you go by? That one is already framed in a way that is explicitly asking not for a legal name, but some folks might be confused. And so if I was asking this question to a client, I would say, you know, one of my next questions for you is what name you use. And I want to make sure that you know that we are okay to not put the name that might be on your ID or on your driver's license, and we'll use whatever name on this form that works best for you. When it comes to what pronouns you identify with or go by, the best way to do this is kind of to explain pronouns as you go. And so, you know, I would say this by asking, you know, what pronouns do you go by? Mine, for example, are she and they. Other pronouns are he and him, and, you know, there's other ones out there that folks might use. Feel free to let me know which one works best for you, and I also want to let you know that this can change down the road. And so if you're not sure at the moment, or you'd want to leave it blank, that's totally fine. Or if you want to give me one set, and maybe we can chat about it in a week, that works for us too. And so it's important here again, just to make sure that we're giving folks a little bit of education as we have these conversations. That is a way to A, demonstrate to trans folks accessing care that yes, we do actually know what pronouns are, and also to help do that education with other clients who are accessing our services so that they can A, be educated, which I think is valuable to everybody, and also because that's a part of making sure that the spaces themselves and the clients accessing those spaces are as inclusive as possible of trans and gender diverse folks who are also simultaneously accessing care.
Yeah. Okay, so when providing mental health services to a young person, it's important to remember that being trans or gender non-binary isn't a mental health problem, as Faye already mentioned. We already have a history of pathologizing transness, and we have systemic barriers in place, especially when it comes to mental health services. So just because you're working with a client that is trans doesn't mean that they're accessing your services because they're trans. It's important to build a relationship of trust and recognize that the impact of discrimination and microaggressions that this young person is probably facing on their day-to-day. It's also important to notice that family can be complicated. Some folks have great relationships with their families, some folks have complicated ones, and some don't have relationships with their family at all. So when interacting with the young people and their families, it's important to know, to follow the young person's lead and not assume what their family knows about them and what their family doesn't know. Also, don't describe someone's experience as gender dysphoria unless they themselves use those words specifically. So we're essentially holding a space for a young person to disclose and communicate their needs, and that also allows for that trust and that advocacy that you'll probably be doing. Yeah.
As we were chatting about, always mirror the language that folks use, right? That is, if you're trying to walk out of this workshop or webinar with one thing, listen to us and the language that we use and mirror that language back to us. And another thing I want to mention really quickly is some trans folks will indeed be accessing your services and be referred there by their parents, and they might use a different name in that session than when they are talking with their parents. You are allowed to make a distinction in the names that you use for a trans person to protect their safety and make sure that if they are not on good terms with the parents, if their parents aren't accepting, that you do not accidentally or unintentionally out a trans kid. This is something that the Toronto District School Board has some very phenomenal policies around and is well established in Ontario's education sector. And we need to make sure that we do that because the worst thing we can do is accidentally out a trans kid to parents who might not trust them. Because 20 to 40% of homeless young folks are LGBTQ identified, and we need to make sure that we're not putting young folks at greater risk of harm. Mm-hmm. On that note, and shifting gears towards primary care, just like everybody else, trans folks often need access to primary care. I know, we break our bones too, it's really strange. But just like everybody, we need access to those services. Sometimes it has to do with our gender identity or a desire to access gender-affirming health care, but often it doesn't. Just like everybody else, folks who are trans have incredibly diverse bodies. Our bodies don't always look like what people expect them to. We still deserve access to supportive and inclusive care. When you're working with young folks in a primary care context, it's important to make sure that, again, that you're mirroring the language that they use. It can also be good to try to avoid terms that might be triggering for folks. Some people who have what we might describe a penis might call it something else. They might call it a vulva. They might call it, there's other terms like strapless, there's a whole bunch of language that folks might use. And so it's important to recognize that that language might actually be a source of discomfort for some trans people. And so always listen to young folks around how they describe their bodies, because I think that is, again, an important principle of trans-inclusive care. Now I'm going to touch on 3 key components related to primary care that I think are particularly important for providers to know. First one is physical. I have a story of mine where I went to a brand new doctor for the first time, and new family doctor, and she wanted to do a physical on the very first visit. I had never met her before. She didn't know I was trans when I walked into the room, and I was sitting there being like, oh God, do I trust this person I don't know to touch my body? It is important to get explicit, informed, and prior consent across the board for folks when it comes to physical touching, but it is particularly important for trans folks who often have complicated relationships to our bodies. You should ask trans folks beforehand. You should also give them prior warning before engaging in something like a physical, because a lot of the time in the moment we might say yes to that, but we might not have actually had a chance to reflect on it and how it might impact us to have you see our bodies, to have you touching our bodies, because again, our bodies are often sites of conflict for some, but not all trans people. Now, another important thing that a lot of folks don't know is around hormones and referral letters for gender-affirming surgery. So nurse practitioners can actually prescribe hormones. they can administer hormones, and they can provide documentation that is needed for physical care outside of surgery. Nurse practitioners have an incredibly important role in gender-affirming healthcare, and it is important that folks who are trans have access to those services as well. Another important thing to note is that nurse practitioners can actually be one of 2 letters for surgical referrals for bottom surgery, and can actually serve as the only letter required for top surgery. If you don't know what those surgeries are, top surgery is usually understood as the reconstruction of chest to make them more masculine. So that is the removal of breast tissue and other stuff related to that. And then bottom surgery is usually described as phalloplasty or vaginoplasty, which is the surgical process through which genitals of one sort are changed to be genitals of a different sort. And so nurse practitioners have an important role to play in those spaces as well.
Sweet. So, what should a follow-up look like? So consistency and intentionality is like hugely important pieces of that. So you want to make sure that you're going to be using like their name and correct pronouns when you're contacting them, or passing information on from one service provider to another. So also remember, like, model what you want to see. If you're talking respectfully about other people's genders, bodies, and using their name and pronouns, other service providers will follow that example. It makes a huge difference when caring for people.
As I mentioned a few minutes ago, 20 to 40% of homeless young folks are LGBTQ2+ identified. But we don't have the data on trans folks because we have really bad data in this province on trans folks. But community knowledge and experience says that a significant portion of those are trans young folks whose families rejected them. At the same time, a lot of LGBTQ young folks are less likely to feel safe accessing shelters and traditional housing environments. These environments are often hostile to them, both in terms of the folks who are accessing those services, and the service providers are ill-equipped to deal with gender and sexual diversity. If someone is accessing your services, regardless of their gender identity, trans folks are going to access the service they may feel most comfortable accessing. I would imagine situations where a trans man or a trans masculine person feels more at home and safe in a women's shelter than in a men's shelter, because you can't imagine the degree of violence that might take place if they are outed as trans in a men's shelter space. As a housing worker, there are some things that you should think about when it comes to working with trans and gender diverse folks. You should think about how to support a trans person who might experience violence in public, with you or while accompanying them to visit a landlord. Have a conversation with young trans folks before you go out in public with them or are going to a landlord like with them to talk through how they want you to respond if that happens. I experienced a significant degree of street harassment. That is the life that I live in. I go outside and people stare at me or people throw slurs at me. It's not an everyday experience, but it's closer than I would like it to be. I don't like it when folks react. If I am with somebody, I don't want them to instigate more violence. I don't want them to confront that person. I want to prioritize my safety, because if you respond, I don't know what might happen next. Have those conversations with young trans folks to make sure that you know how to support them in those moments. You also need to be honest about the realities of shelters and other housing or health and social services. If you're referring people to another service, you cannot promise that it is going to be inclusive. You need to be honest about that. You cannot set people up for failure. If you guarantee that they'll be safe in this service and they have a bad experience there, their hopes and expectations and their trust with you is shifted in a way that is quite significant. Last, of course, as I mentioned, let clients guide their decisions around accessing gendered services. They are the best experts in their needs and experiences. Around all of this and in general, there's a really great policy that is led by the Youth Services Bureau of Ottawa around pronouns and also how access to gender-affirming or gendered services looks, and I'd recommend folks check it out because it's probably the best one that I've seen thus far.
I just want to quick note. So it's important to also consider like the intersectionalities when we're doing like housing, because it's important to note that like a Black person or even a poor person of color face extra barriers when accessing like housing. And of course, on numerous occasions, like people with those like intersectional identities have had negative experience with landlords and apply for housing. So just keep that in mind when you're providing those kinds of services. Right on. So employment. So as we know, 50% of trans people in Ontario make under $15K a year, which is very realistic for even someone trying to live in Toronto, especially. So many trans young people have experienced employment discrimination and hostile work environments. Folks often get segued into jobs such as this, where we're educating the community on our own identities, and we also need to recognize that there are different kinds of racial barriers that folks experience. So 22% of trans people of color have been turned down for a job due to their race and ethnicity, and that's not a coincidence. Yes, trans people are recognized under the Human Rights Act, but many trans individuals just don't feel empowered to access legal services due to the erasure and violence that they experience regularly.
It's also really, it's tedious process. Like, it's not easy to pursue a human rights complaint, and it's a reactive process, so it doesn't get you the job. It just means that you can hold the person accountable for the fact they didn't hire you because you weren't a white cis person.
Which could just lead to more violence, essentially. But yeah, so for folks like actually getting access to resources for things such as like free interview clothing for youth, it's important to recognize that those resources are like incredibly gendered, and gender is ingrained in our systems and all of our services. So as service providers, it's important that you recognize these things when offering folks those services. Ask the young person what kind of supports they might need when accessing services. So as Faye said earlier when talking about housing, like, you know, if they want to bring a friend, if they want to bring their worker, and then even putting a plan into place what, like, in case things go negatively, even if it goes positively. So let's move on to, let's move on to the takeaways. So just as we're finishing up, here's a few takeaways that we hope that you folks got. So use language that doesn't reduce the youth to one aspect of their existence. Be mindful to young people that are hearing messages you use when discussing them. Craft intervention strategies that take into account the varied experience young trans people face. Find ways to build upon the strength of gender nonconforming and trans youth in programs and public-facing campaigns. Recognize that race silent is not race neutral. Name youth of color as the most impacted when talking about trans youth experiences. And finally, warm referrals are always helpful and necessary. Often trans folks get passed down many vines to access adequate care, and it's important to support them. And use resources to support that process. My bad, sorry. And if having to make the referrals, try and call a place, connect with someone. Just so you know that the people you're referring the trans youth to are knowledgeable, and you know the space is inclusive. Okay, so we have a little resource page. Sorry, Faye, go ahead.
Oh, no worries, no, go ahead, you're good. Or do you want me to take?
Yeah.
So these are just some resources that folks can consider or can check out. Rainbow Health Ontario is, if folks are looking for access to expertise on medical-related or transition-related healthcare, they're the best folks to go to. They have weekly mentorship calls on Wednesdays from 12 to 1, and their website features tons of resources on transition-related healthcare. LGBT Youth Line is an organization that Jack and I think, both hold in a special place in our hearts. And they are, I would say, the best organization doing youth-led peer support buy-in for LGBTQ communities and young folks. They also have a very strong commitment to anti-oppression and anti-racism that is implemented more significantly than I see in a lot of organizations. There's also a really great report that gets into some of the meat of what gender-affirming care looks like that came out of a group called, this is the safety report, right, Nikita?
Yeah, exactly.
That came out of Support and Education for Trans Youth, a Ottawa-based trans youth group that did a report of the experiences of young folks and their families accessing care at CHEO, Gender Diversity Clinic. It looks at the meat of it around what are the issues around gender-affirming care and how we aren't actually implementing it entirely. The guidelines to Sherborne are also around hormone therapy and primary care. And then Trans Lifeline has free online medical consultations. And there's also tons of other resources out there. And so check out the services in your communities. Build relationships with the trans and LGBTQ organizations connected to the communities that you're working with. Those folks know the context of trans young folks in your region better than we ever could. And so listen to them, build relationships with them, and make sure the trans young folks are part of those conversations.
So we're going to be moving, that's all you?
Oh, yeah. My biggest thing here is, you know, I don't want you to walk away with this conversation saying, trans young folks, wow, they have mental health problems. At the end of the day, trans young folks are brilliant. They are resilient, and they are so incredibly valuable. I have the privilege of working with like 15-year-old trans kids who are making such incredible contributions to their communities. Yeah. They are strong and they are resilient in the face of a world that actually doesn't want us to really be here. And so I don't want us to walk away with this frame of reference that re-marginalizes trans young folks as an at-risk population, but acknowledges the fact that they are actually more resilient than we are. They have survived in a world, they are existing as their authentic and honest selves in a world that doesn't want them to exist, in a world that still enacts such immense violence upon them. Trans people don't need to, have training on resiliency because we know it better than most people do. And so we need to honor the knowledge, wisdom, and experience that trans folks bring to the table.
So, yeah.
Okay, so we're going to go into questions. Thank you all for staying with us and for asking some great questions. Quickly before we go into questions, I'm just going to give a quick thank you to Jack and Faye for doing such an incredible job and providing us with all this knowledge. I also want to thank a few other people. I want to thank Janice from Vibrant Healthcare for some support around primary care. I want to thank Amanda and Debbie from Skylark, who are just so great and so supportive and have provided a lot of resources as well. And David Phillips, who has been the back end of all of this and has been doing all the PowerPoint slides and all those things. And it takes a team to make these things happen. So thanks to everyone.
Thank you.
Thank you.
And I'm actually going to run to the washroom as we start the questions, so I will be right back. Okay,
so let's get into some questions. So the first question is from Reshma. Hey, Reshma. There has been a debate through offering other trainings I have sat in as to if folks should ask what is your preferred pronoun versus what is your pronoun, as some highlight this isn't a preference while others choose to say it is. What would you recommend when working with young people specifically?
Well, I think if someone came up to me and said, "What are your preferred pronouns?" For me, that is a problem because why are you coming up to me and saying, "What are your preferred pronouns?" Are you trying to peg me as, yes, I'm trans, but also my pronouns are he, him. It's not my preferred pronouns; they are my pronouns. You know what I mean? But that's my experiences. And if you interact with other trans youth who do say, "These are my preferred pronouns," I would just leave it at that. That's what they say their preferred pronouns are.
Yeah, and I think the important thing to think about there is that everyone's experiences around those things and preferences are different. So I think really just, I don't think there's no clear cut answer to that because I think people prefer different things.
Yeah, pretty much.
Okay, thanks Reshma for that.
I hope that was a good answer.
Okay, so Firefly, how do you provide support to a younger individual when their families are not supportive and religion is a factor?
Okay, so I think speaking from my own, that's a really good question, and I think it's a very layered question, and I don't know if I'm going to even be able to answer it with the depth that it needs because I think it's so layered. But I will say, first and foremost, you're supporting the needs of the youth in the moment. So figuring out so I'm just going to refer back to the question. So figuring out how they need support in the moment, like whether it's emotional, are they planning on staying in their household? Are they comfortable staying in their household? Do they feel like it's harming them in some kind of way? And figuring out all those pieces. And then moving forward from there, because honestly, you can meet someone who's like, yo, my family is the worst, I don't like being around them, but at the end of the day, that's the safest place for them. It really does depend on so many factors, but I think the answer is working with them and following their lead. So Faye, we were just going through, so the question was, how do you provide support to a younger individual when their families are not supportive and religion is a factor?
Thanks. I missed the answer, but part of my response would say, see if you can help families connect to support groups of families. I've seen really phenomenal work with religious families in religious contexts who were connected with parents who've gone through it and been there, and they can have some of those hard conversations, but also be there to hold their hands through it. And I think that, to me, has been a silver bullet from the work that I've seen.
Thanks. I think Amanda asked a question and you answered that, so that's great. From Kelly, what would you suggest when working with youth that do not want employers to disclose their gender, however, also don't want to be asked how they identify? I want to do what's best for my client. Any ideas?
So I think I'm reading, so it's a situation where somebody doesn't want to disclose their gender at all, but you also want to be supportive, right? And so I think in that dynamic, young folks don't have to disclose their gender identity or their gender expression, and unless they're bringing it up, it isn't always relevant. But I would say provide invitations and opportunities, right? So make sure that you introduce your own pronouns, make sure that they know that you're a safe person to talk about that with. But they might not be ready to. They also might not care, or they might say that, you know what, the world's too obsessed with my gender and it should just leave me alone. And so it depends on the young person's context, but I think that would be my recommendation.
Yeah, to be honest, I would agree with that in that instance.
I just want to read a comment from Steph.
I was actually writing out my response to it as before we got into the questions.
Well, we can talk about it now since we're here.
So Steph made a really great point. I noticed earlier on it was mentioned that trans is not an identity. I don't know if I completely agree because it depends on the way people use language. Would it then be best to just listen to the needs of those we are assisting and respect that the way they describe their gender is true to them, if that makes sense?
Yes. The way that I explain this is I don't think we were intending to say that trans isn't an identity. We were trying to say that it isn't a gender identity. It's a descriptor of gender. And so some folks might call themselves something, like they might use like trans woman as one word, or like they might use it in different ways. But I do identify as a trans person, but my gender is not being trans. It is a descriptor of how I experience my gender. That being said, yeah, there might be young folks who describe that differently, who are experiencing it differently, and so always mirror the language of the folks that you are working with. The main reason I think we made the distinction between a gender identity and like trans as a descriptor of is because a lot of the time folks don't realize that trans people also have genders aside from just being trans people, and that it's important that we acknowledge that we also come to the table with genders, and that sometimes the gender is as important or more important than the fact that we're trans. I don't always want to be a trans person. I sometimes want to be the gender that I am.
Yes. I think for me in my experiences, I think I'm still trying to navigate that, and I think that just goes to show that everyone's experiences are very unique. So yeah, just kind of mirroring that language.
Yeah, again, young folks are always the best experts in our experience, and our language around gender and identity are evolving. In 5 years, we might be having a very different conversation than the one we are now. 20 years ago, this conversation was using very different words as well.
I don't think we have any other questions there right now.
But I see a ton of people typing.
I do. I know. I'm waiting. I'm waiting. Please, Kelly, I have a couple more questions about youth and employment. Any way I can reach out to you, Faye?
Yeah. So I think our email addresses are on the slide. I think on one of the first slides.
They should be. If they're not, we are going to send out the recorded webinar alongside the French and English slides, alongside the 4-pager that David created. And with that, we will also pass on, if Jack and Faye are okay with it, their emails for people to get in touch with them. Hire them. Pay them all the money to do all the beautiful things.
And if, in the meantime, if you are really impatient and want to just get in touch, my email is faye@wisdomtoaction.org, or you can check out my website at fayejohnstone.com.
Okay.
So just a comment, such a great point about considering the microaggressions that a client may face on a daily basis and the impact that this may have on their interactions with professionals. This is a great takeaway for me to bring into my practice with youth. Thank you for this wonderful presentation. Oh, thank you.
Thanks, Natalie.
Thank you.
That's
really sweet.
Okay, we have. Okay, I think these are all thank yous now.
Yeah, we do have a question here around, do you have any advice on how to encourage or support someone to access support from YWHO or other agencies in the area, especially when they might feel nervous doing so? My quick take on that would be, if they're a trans young person, like the best way to build those relationships of trust where folks will feel comfortable accessing your care is to help, A, make sure that your internal policies and practices are aligned, B, make sure your staff are trained, C, engage actively with trans communities. Trans Day of Remembrance is coming up in 14 days. It's on November 20th, and it is the international day where trans folks gather in communities across the world to mourn the trans people who have lost their lives to murder and violence this past year, for predominantly Black and brown trans women. If you want to start building relationships, show up to the local events. Show up and be there, tweet about it, post about it on your social media, build those relationships as the best way to make sure that folks trust you and have the opportunity to access services at your agency when they need it most.
Yeah, it's really about like educating yourself and accessing resources to do so.
Okay. So if we really want to get information, I know a few people have said something around not being able to click the survey link. So if you click web links to, you see the Survey Monkey, you click it, and then you say browse to, it will open. Okay? Hopefully that is clear. I think we are out of time. So thank you again for all being here. And yeah, thank you both, Jack and Faye.
Oh, thanks everyone for inviting us.
Thank you, folks. Yeah, and good luck at the hubs moving forward.
Cheers.
Bye.
Bye.